Today, homelessness in New York City is a huge problem, a bigger problem than ever before. 70,000 men, women, and children are homeless in the 5 boroughs. Over 4,000 people sleep on the trains and in the streets every night. In the midst of the coronavirus pandemic, which has seen millions of Americans lose their jobs or seen their paychecks get dramatically cut down, it's clear that homelessness will continue to become a bigger problem in New York City. Today, I'm joined by Sasha Murphy, who's a case manager at a homeless shelter in the Bronx. Welcome, Sasha.
Thank you for having me, Monica.
Thank you for joining me. So let's get right into it. Obviously, as I laid out, homelessness is a huge crisis in New York City, and it will undoubtedly be made worse by the pandemic. Can you tell me a little bit what your day-to-day has been like at the homeless shelter in the midst of all this chaos?
Yeah, sure. I just want to thank Breakthrough News for having me again. And you know, it's really crazy right now because there are so many people who are in desperate need in the shelter. I mean, shelters currently have over 60,000 occupants and people who are fighting to get in because they simply have no other way to go. People who are in shelter typically are people who are on food stamp benefits, who will receive welfare, who receive Social Security. They have fixed incomes. And right now, we're witnessing almost a freeze on every department. I mean, people who are already disenfranchised are really struggling right now to obtain their benefits. I have clients who are just really worried about how they're going to get their next paychecks, if at all, how they're going to get their SNAP or food stamp benefits, how can they get them turned on if they've been turned off. Um, and it's just really getting even more crazy by the minute. We're just trying to do everything that we can as human service workers and case workers and social workers to be able to provide services, but we ourselves are very limited in this coming period and are just doing the best that we can to help these people.
Not everyone has the ability to work from home. We see a lot of our essential workers are still expected to show up to their places of work every single day. And clearly for homeless folks who have nowhere to go, social distancing is near impossible, and particularly for folks within these shelters that are already overcrowded. Can you talk a little bit about this social distancing?
You know, people who are in shelters are forced to live in dormitory style living. So the shelter that I work with, you can have anywhere from maybe 4 people in a dorm if you're really lucky, or up to 14. There are some shelters in New York City that can have anywhere from 60 to 100 beds in a large dormitory, and that's the entire shelter. The reality of trying to quarantine people, the Department of Homeless Services has come up with the idea of taking one individual and putting them in a so-called quarantine shelter. So if someone is showing symptoms, not that they'll be tested, but they'll then just be quarantined in a particular shelter. I mean, I don't know if this really changes anything because that shelter still has to have shelter staff. Those people have been told that they can come and go as they please. They're not receiving regular medical treatment. They're not being tested unless they have overt symptoms and over underlying medical issues. This really isn't quarantine really at all. It's just the Department of Homeless Services vain attempt to just keep people, I guess, out of the sight and mind of many other people in the shelter. And frankly, by the time they move these individuals out to the so-called quarantine shelter, it's very likely that they've infected the entire dorm at that point. If your roommate's been up all night coughing, with shortness of breath or showing any other signs of the virus, it's very likely by the time they're so-called quarantined off from everyone else, that they're going to spread it. There's already been an individual who's been infected at my shelter and 3 other individuals who have been quarantined. For all I know, there could be many more at this point too. So it's just ridiculous that we are being told to social distance, and yet the already disenfranchised have very little ability to do that. They're, if anything, much more exposed to this virus than others.
What do you believe as a city worker, as someone who's working with some of the most vulnerable communities in New York, what do you think the government should be doing, not only at the city level, but at the national level, to make sure that homeless folks and other vulnerable folks are taken care of during this crisis?
Yeah, I think that's an excellent question. I mean, you know, the most disgusting thing that I've read recently is that the city is decided that construction work is still mandatory, and yet these condominiums and these kind of gentrification projects that they're building are still into effect. I mean, how ridiculous is that when you have this overwhelming homelessness and at the same time you have so many people who are leaving so much of the city so vulnerable? Um, we need the government to put people before profit. We need real plans to be able to meet that. People who are in fixed incomes need to make sure that they'll have some money. They need a real medical attention. People across the nation need real medical attention, and there should be testing available for everyone, free and readily available testing for anyone, especially frontline workers who are putting themselves out there every day to assist these people too. We're not having much access to testing unless we're showing overt symptoms ourselves. We need on a nation scale. I mean, so many people are unemployed. Unemployment is projected to potentially go up to maybe 30%, possibly even more. There are going to be so many people come April 1st who may not be able to pay their rent here in New York City and throughout the country, probably. So, I mean, we need to freeze rents. Absolutely. The federal government is absolutely capable of doing that. We need to make sure that we have the medical equipment necessary to be able to protect people who are giving care right now. All these factories that are producing things that are just making profit, they could be converted to places to make masks and other types of protective gear. And we need to make sure that benefits are being dispersed to people, real benefits that can help people be able to feed their families and have an actual plan, to talk about how this homeless crisis is already deep in so many parts of the country. But I mean, the fact that we're building condominiums at this very moment means that we could pretty much potentially eradicate homelessness here in New York City. Those people are all entitled to homes. We can have a plan in effect from the federal government to have state operated places where we actually enforce that there's a home for everyone in New York City and throughout the country. So these things aren't really utopian. They're just not planned for because our society, our government absolutely puts profits before people. And we've seen that with COVID-19 and how the federal government has made every opportunity to put profits first. They had too much to plan for the inevitable arrival of this disease and are still dragging their feet. And we've now exceeded the numbers of people who've been infected past China. We've not even seen the peak of this. So at the very least, this is the time to show that, we need to have solidarity and come together. But as me as a human service worker, I'm limited. A nonprofit can only do but so much. We can't put our faith in those industries. We must put the blame and the ownership on the federal government, on the government who has the power and the wealth to be able to meet the needs of people.
Well, very powerfully stated. Thank you so much for joining us on Breakthrough, Sasha.
Thank you for having me.